At the Health Recovery Centre, we treat depression, anxiety and mental health symptoms physically. Okay, they are a physical issue, so talking about it doesn't make it go away. So what we actually need to do is address the neurotransmitter imbalances, which are the brain chemicals that determine all of our behavioural characteristics. We need to address stress hormone imbalances if there's any there, female or male hormone imbalances if there's any there, because of course we all know that they determine our behaviour as well. And then we need to address any digestive dysfunction, because that is where our neurotransmitters are actually made, in the gut. So this is a physical treatment for a physical problem, just like any other health condition. So neurotransmitters are the brain chemicals which determine all of our behavioural tendencies. They determine our sleep cycles, our memory, our cognitive function, our ability to problem solve. They determine our relationship skills, so the way that we interact with other people. They regulate our attention, our ability to concentrate, so we get attention deficits if they're imbalanced. They regulate whether we have anxiety or depression, even severe mental health conditions such as hallucinations can be down to these neurotransmitter changes. So by ensuring that we treat the neurotransmitter imbalance in the first place, the mental health symptoms naturally disappear. So neurotransmitters are made in the digestive system by digestive bacteria. When those digestive bacteria get imbalanced, like it could be from getting an infection such as going to Bali or something like that and getting a gut infection that causes a change in the type of bacteria that are there. It could be antibiotic use. It could be coming into contact with too many other antibacterial agents. Even things like regular Panadol use can actually kill the bacteria that make our neurotransmitters for us. So it can be really simple. All we need to do is test to determine what type of bacteria are there and then change those bacteria. Then of course you'll have the flow-on effect to those neurotransmitters. Your digestive system improves, your mental health improves, and your relationship with stress improves. So you get that complete reduction in all of those symptoms and you get on with a new healthy and happy life. So there's 12 neurotransmitters that are responsible for all of our behavioural characteristics. When you get treatment through Main Street Mental Health, you usually only get treatment for one or two. So a lot of people have heard of serotonin and dopamine, but they haven't heard of the other neurotransmitters that are involved in our mental health. So out of the 12, 6 can be responsible for depression and 6 can be responsible for anxiety. So there's no good just treating one. There's no good just taking an antidepressant and hoping that works for life. If you're getting any digestive symptoms at the same time, any sleep or cognitive deficits where you can't concentrate properly, where you feel like you don't remember what happened the day before, there's a very good chance, or even a few years before, there's a very good chance that it's a neurotransmitter imbalance rather than, just a thought pattern issue. So you need to actually address the physical side of depression, which is that brain chemistry. The reason why it happens is because you have 3 main things that all interact. So your digestive system being out of whack, having the wrong type of bacteria or having something that's not functioning properly, so whether you're not releasing enough gastric acid or digestive enzymes, means that you don't produce normal levels of neurotransmitters. And your neurotransmitters are your buffers to stress. So poor neurotransmitter levels means poor stress tolerance. And your body compensates by that by producing additional stress hormones. The stress hormones being elevated then physically turns off or down regulates your digestive function, which further causes problems. So worsening digestion, worsening neurotransmitters, worsening stress hormones, worse digestion, neurotransmitters, stress hormones, and you just get stuck in this cycle where all of those factors are impacted. And then of course it takes over your whole life, where you're getting symptoms, groups of symptoms, anything from chronic pain, depression, anxiety. You might have, really significant fatigue, like chronic fatigue syndrome type symptoms, or you might just not be able to sleep. All of these things all tie together because of this brain chemistry. So you can't just address one. You have to have all 3 of those things working, which is why mainstream mental health treatments don't always work, because we don't treat the gut, or they don't treat the neurotransmitters, or they don't treat the stress hormones. They just treat one of this cascade of issues that cause those problems. We believe that healthy doesn't have to be hard. So to find out more, go to our website at healthrecoverycentre.com.au. All of our contact details are on there. You can book a free consultation with one of our practitioners. You don't have to come to site, we can do it by phone, and then we can determine where to go from there.